My name is Imran. I'm a forensic psychiatrist. I work for the Midlands Partnership NHS Foundation Trust. We are a mental health foundation trust. We are quite a big trust. We serve about 1.7 million people. We cover a geographical location of about 2,400 square miles, and we employ I think around 10,500 staff members. If you are joining the new Anglia University, you will have the opportunity, depending upon obviously your program, you will have the opportunity to experience all these subspecialties within psychiatry, both within the inpatient as well as the community settings. And then something I really wanted to highlight was that we have very established and supportive networks and structures for medical education as well as training. So I'll talk about the education first. We have contacts with the Keele University, and we have contacts with the Aston University. So we regularly receive their medical students. So it is really important that I emphasize that if you are doing your psychiatry placement with the MPFT trust that I represent or I work for, then you will be working with all these doctors, and obviously you will be having that exposure of how the psychiatry is practiced in the UK. In terms of our sites, we have two main inpatient sites. The first is St. George's Hospital. It has got several hundred beds. It has got community links. In terms of the facilities for you, we have the medical education center. We've heard about the simulation suite at King's Hospital. We also have a state-of-the-art simulation suite where you can work to kind of try your knowledge and skills under supervision before practicing them in real life. We have a very active postgraduate medical education program, and you'll be more than welcome to attend. The second site that we have, the inpatient site, is the Redwoods Hospital or the Redwood site in Shrewsbury. And again, we have quite a few inpatient and community services based there. They have their own setup to promote medical education. And again, their facilities are quite state-of-the-art as well. And you will be able to attend all the distinguished speakers' talks or postgraduate medical education initiatives that they provide. So I think it's really important to emphasize that we are not in any way competing with any of the acute medical hospitals. We are in a way complementing them by the exposure and the support that we can provide. So if you are doing your 6 weeks placement with us, then depending upon what you want to do and depending upon the colleagues or the specialists who are working with us, you can do your placements in a range of psychiatry subspecialties, in a range of inpatient and outpatient settings. As we heard, you are going to work in multidisciplinary settings. You'll be working with social workers, with mental health nurses, with psychologists, and with the physical health experts as well. And you will have a named undergraduate lead. You will have an undergraduate tutor, and they will work with you to make sure that you have a schedule where you know when you're going to do your tutorials, when you're going to see your patients, and when you're going to come back and do your presentations and have the space for reflective practice, because we believe that in psychiatry, reflective practice is the most important bit of your training. And in UK, there's a lot of emphasis which is put on reflective practice. The most fascinating thing that you can experience in forensic psychiatry is that you get the exposure of mental health, of UK mental health legislation. And if you were training abroad, then you won't have any exposure to these two pieces of legislation. But if you're doing your clinical placements in UK, then that means that from the very first day when you start working as a foundation doctor or as a core trainee, you know exactly how these two pieces of legislation they interact with the clinical practice, and then you can use them quite seamlessly to kind of to improve the patient care that you provide. In the NHS, we are again quite hot on making sure that we are improving our services all the time. And if you're working abroad, if you're doing your clinical placements abroad, the quality improvement emphasis and the projects that are quite unique to the NHS, they might not be available overseas. So that is all I wanted to say. If there are any questions, I'll be happy to answer them, or I'll stay outside and if there are more questions, I'll be.
Thank you.